Drivers who think they've had too much to drink over the holidays. But what causes people to drink, and what psychological impact does drinking have? Joining us now to tell us more about the effects of alcohol is Dr. Clemmie Palmer, a psychiatrist at Meadhaven. And Doctor, thanks so much for joining us today.
Thank you for having me.
Now, first of all, start off by telling us what are some of the main reasons you see that cause people to drink excessively during the holidays?
Mainly to socialize. A lot of people are very anxious and wants to drink a bit more to be able to mingle with family and friends, to lift their confidence, just a million reasons.
Are there measures that folks can take from becoming intoxicated during the holidays?
Yes, I always encourage people to make a contract with a family member or a friend so they can know when to stop drinking before it becomes a problem.
And what is that, just a kind of a promise between the two of them that they won't drink or that they'll stop? I mean, how does that work?
Right, it's a preset number of drinks for patients that can sort of handle their alcohol. Say, for example, most people say they can drink about 2 beers. So they know to stop at 2 beers and not drink anymore. Most of the time they do better if they have a contract that's already preset.
And have you found that to be successful in the past?
Yes, ma'am.
How many people in the U.S. abuse alcohol, and how many are actually alcoholics?
There's about 17 million people in the U.S. that actually abuse alcohol, and 50 million alcoholics in the U.S. So it's a big problem.
I think that most of us have heard of AA and organizations like that. What are some of the common treatments for alcoholism?
I believe individual therapy is a very effective treatment for alcohol-related problems. Group therapy, AA meetings, all those are great. Sometimes we have to resort to medication also.
Are there any, or are there common psychiatric disorders that contribute to excessive alcohol intake?
Exactly. A lot of people drink when they get depressed to titrate their mood states, and a lot of people drink when they're very anxious to sort of relax and have a good time.
Now, you mentioned that people tend to drink more over the holiday season when they're anxious. What about when they're depressed? Do you have any suggestions for people who might drink when they're depressed?
Yes, I hope patients sort of seek treatment before the holidays, but if not, at least around the holidays, because if the depression needs to be treated first. If they continue to be depressed throughout the holidays, they're more likely to drink anyway.
Any last advice before we let you go today?
Just need a designated driver.
All right. Dr. Clemmie Palmer, thanks so much for joining us. We sure appreciate you coming in.
Thank you.
And let's go to Dan Atkinson.